9 minutes past the hour. Though the number of coronavirus infections continue to decrease, questions and, of course, concerns continue to circulate around the different variants. For an update on the latest coronavirus headlines, we turn to Dr. Nina Radcliffe. Happy Friday to you. Thanks for joining us here on the National Desk.
Happy Friday to you.
First, let's talk about some of the things that Dr. Anthony Fauci has said. He said we should expect to see open season for vaccines by April. So how confident are you that everyone's going to have access to be vaccinated by the spring?
Well, I think this is highly possible, but it's important to understand what this means. At this point, only select groups are eligible to receive the vaccines, and this was strategic based upon the limited supplies. The Centers for Disease Control and Prevention, which is a federal agency, provides guidance to the state health departments who have the ultimate jurisdiction on how it's going to be distributed. So that was with the intent of making sure healthcare and certain frontline workers, as well as those most at risk, such as heart disease, obesity, smokers, the ones who have the most severe consequences, are first in line. Now, as vaccine supplies will increase in March and April, this will allow for a much more of a mass vaccination approach, or what we're calling open season. So almost anybody and everybody can get vaccinated. You no longer have to qualify for a check mark and over age 65. I'm a firefighter, I'm a teacher, I'm a doctor, I'm a nurse. Anybody and anyone, any profession can qualify.
And Dr. Radcliffe, are you surprised when you see these headlines, 1 in 3 Americans still say they will not get the vaccine? Because we know that's going to impact achieving herd immunity. So what will that mean if we do not get the herd immunity? What will it mean if 1 in 3 Americans will not get the vaccine?
Well, it is concerning because in order for transmission to stop, enough people have to have either had COVID-19 or vaccinated and be immunized. So as vaccines are more widely deployed, we're going to reach the milestone of herd immunity. So herd immunity is, again, so many people are immune to getting sick with it that the virus can find nowhere to go. It can no longer thrive. It can no longer survive. Viruses are parasites. They cannot live without us. So again, people who are concerned about it because of the pace that it was developed or some of the side effects they're hearing about, I encourage them to talk to their pharmacists, to talk to their doctors, and learn more about the vaccine. Don't learn it from social media. Unfortunately, misinformation is spreading faster than this virus.
Yeah, and you know what? I saw this headline. I wondered what you thought about this, that indicated that vaccines could cause the virus to mutate into even more variants. Is this normal, and is there a way to really control these mutations?
Well, we're going to hear a lot about mutations and variants in the months to come. Although this is a theoretical possibility, I don't want anyone to panic. There are experts who are watching every one of these scenarios very carefully, and there's no data at this time. So while there's a lot of unknowns, we do have knowns. The things that we can do is that we wear face masks, we socially distance, we wash our hands, and we get vaccinated. That's the best way to stop spread and to stop these mutations and these variants.
And the CDC did announce individuals who are fully vaccinated can skip quarantine if they've been exposed to someone with COVID. So if that's the case, can people who have been vaccinated visit loved ones without social distancing?
Well, there's some caveats to this. It has to be within 3 months of getting fully vaccinated, and you have to get both dosages as well as 2 weeks after to make sure that your immune system has kicked in. We still want people to wear face masks and to properly socially distance. So this is a step in the right direction, and more of the good news we're hoping to see as we continue to get vaccinated.
And I'm curious what you think about the double masking. And is it a double masking that we should do all the time, or only when we are coming closer into contact with someone, when we're out and about? And I also saw a headline, an interesting headline that said double masking, yes, triple masking, no.
Well, I stand with the Centers for Disease Control and Prevention and the millions of frontline healthcare workers that say face masks work, but it's important that they properly fit you and they have enough layers. It needs to be over the nose and the mouth, and we have to be cautious about the sides, because if air can easily enter and exit from there, it's a problem and COVID can get in. We need to also wear enough layers, but be able to properly breathe. It's all about protection. If it's there to block entrance of COVID into your face, into your nose and your mouth, it works. And if it's not going to work. So yes, 1 layer, 2 layers, we just want to block entry of COVID-19.
And very quickly, I also saw where you're not supposed to put a cloth mask over like an N95 mask, right?
Correct. The thing is, we want to prevent entrance and exit. The important thing is we want to be able to also breathe. So again, wear it over your nose, wear it over your mouth. Make sure there's no leakage from the sides. You can use loops. You can use a nose guard. Just be smart. And also remember to stay physically distant from people about 6 feet.
All right, Dr. Nina Ratcliffe, always great to see you. Have a great weekend. Thanks so much for joining us.
Have a wonderful weekend.
44 minutes past the hour. An NBA player has been through more than most of us can even imagine when it comes to COVID. We're going to talk